Thank you very much, Bruce. So, without further ado, Sustainable Development Goals. Who did not hear about it? Oh, no, I was hoping that somebody will raise the hand. So, if you heard about Sustainable Development Goals, you probably did not hear about this one, because I just figured it out last night. This is not written in any official document, because Sustainable Development Goals, basically what I tried to do, that how can we get it into the next few slides we have? So for me, it's the goals that have economic, social, and environmental sustainability. In fact, it is defined. The sustainability is defined with 3 pillars: economic, social, and environmental sustainability under good governance. Now, what does that mean? The next slide. So for me, they are developments that are economically viable. So every development is possible, but it all costs money. So it has to be feasible. We have to be able to do this thing with the resources we have. But it also has to be something that is demanded by people and acceptable. So it's socially demanded and acceptable, environmentally friendly, and politically willed. So this is my interpretation of SDGs. I don't know whether you have the same interpretation or not, but let's just stay on that and let's see how they are relating to the rest of the stuff we're going to say. So that SDGs underpins human rights. I don't know whether you're all conversant. This is the so-called leave no one behind. This is for everybody. This is no longer MDG. This is a game changer. This applies to the country of origin of mine, Bangladesh, which did not meet the sanitation target. And it applies to Australia, which met both the MDG target for water and sanitation. And we'll come to that when Bruce will introduce the differences we will introduce. So in the Transforming Our World document, which is the document that the UN General Assembly passed in 25th of September last year, the world leaders said they want a world where we reaffirm, so it's the leaders are saying that we want our commitments regarding the human right to safe drinking water and sanitation and where there is improved hygiene. So it's actually enshrined in that document about human right to water and sanitation. Now, in the annex of the document, there are these 169 targets, and these are the WASH targets, the drinking water, sanitation, hygiene targets. The one on water calls for by 2030, which is the deadline for the SDGs, to achieve universal and equitable access to safe and affordable drinking water for all. Note the word universal and the reiteration of that at the end, for all. I have had actually hours of discussion with the Special Rapporteur on Human Right to Water and Sanitation, Katerina de Albuquerque, why it is important to have the word universal and for all. In fact, they are in legalistic terms meaning 2 different things. But note the phrases that I've highlighted in red. So these are the phrases that are relevant for the human rights people. And now for sanitation, it's the target is by 2030, achieve access to adequate and equitable sanitation and hygiene for all, and open defecation, and paying special attention to the needs of women and girls and those in vulnerable situations. Again, the human rights dimensions are highlighted in red. Now, this is about WASH, but it is not just about SDG 6, because it cuts across the entire SDGs, the entire spectrum. In fact, I have highlighted some of the things here that it cuts across the entire SDGs. So there are all these other targets that have the WASH underpinnings. But the ones I have highlighted and circled are actually with specific elements of health. So like universal access to basic services. So Bruce will talk about the WASH in healthcare facilities, for example, and all forms of malnutrition and preventable child deaths and neglected tropical diseases and combat waterborne diseases, achieve universal health coverage, which is the mantra of the World Health Organization and the World Bank, and substantially reduce deaths and illnesses from water pollution. But then there are other elements where health is much more implicit rather than explicit. Now, this is where Bruce will walk you through the direct links to health.
Yeah, if there's kind of one slide that I want you to really absorb, it's this one. I hope you can kind of see it. And it really kind of captures, I think, the essence of the SDGs, and at least the way I interpret it, and I think the way maybe the countries all around the world should interpret it. And it's this notion that we need to think beyond universal access to basic services, which has really been a struggle for many countries around the world just to get, and that's what we were measured on. That's what our metric was for the MDGs. And I think that's something that obviously will still be on the agenda. But if we really look from that kind of perspective of health, and I don't know if there's any epidemiologists out in the audience now, but you start looking at health gains, and this is looking at diarrhea specifically, which is the biggest driver on impact from unsafe wash on water, sanitation, and hygiene. You're looking, the latest evidence that we have suggests 10 to 20%, let's say, gains, health gains, in terms of diarrheal disease reductions from basic services. So basic services like a simple pit latrine, an improved sanitation facility, or on the water side, maybe a borehole, a protected spring, or a piped water supply. But really just looking at it from the perspective of infrastructure, no more. We start moving on to safe management, and that's sort of been the mantra, and it brings in all this complexity, which I'm going to talk about, but we're talking about regulation, we're talking about continuous supplies, those things Rifat mentioned earlier. In terms of sanitation, it's not just this idea of having a place to go to the toilet that separates this excreta. We're going to talk a lot about excreta and open defecation. I hope you're okay with that. We're sort of desensitized, but from basically taking that away from your family. So your kids and your family members do not contact, essentially, that poo. But what happens to the community? This is what we're worried about now, because I think we can say the health gains from water, yes, you can get contaminated water and get sick, but you also get all these health gains from having enough to wash with, to clean your house with, to do your laundry, all these wonderful things you can do with lots of water, not just water for drinking that's safe. On the sanitation side, I mean, we've all seen, very familiar with, streets all over the world that have, that are filthy, that have excreta on them. And you can imagine just the type of exposures you get throughout the community. So it's not just a matter of your household, it's a matter of actually getting that out. And for all of us here, it's a sewerage system, right? That's what we go to the bathroom and it's gone away and hopefully treated somewhere. And what I'm talking about in many of these contexts is not a sewerage system. It's looking at on-site solutions, which many of you know well, but how do you empty those safely and take them so that they are not ending up overflowing and affecting communities, and that's worth it for health. Now, Rifat talked a little bit about, some of the metrics for the MDGs and some of the broader targets for the SDGs. What this really is we're getting into indicators. So there's this goal, yes, we do something about safe water, and then we have all the targets, there's 6 of them, and throughout the conference we heard one of the transformative things is that we're not dealing with a WASH agenda. We're not dealing with taps and toilets anymore. We're dealing with water resource management, water availability. We're dealing with climate change. We're dealing with trying to figure out water allocations for agriculture versus basic services. So that's the target level. And then on the indicator level, specifically for drinking water and sanitation, this top rung, which I just mentioned, safely managed, has some differences. And these differences, it's in these differences where we're going to see policy change being driven. Now, I'm not going to go through all of it, but for safely managed water, obviously what that means in practice as far as management, here in Australia we have these HACCPs, we call water safety plans at the World Health Organization. But the way things are, it's tough to measure that because it's a management approach. We'd like to measure it, we do measure it, but it varies in terms of outcomes. So we're looking at an improved water source. So that's looking at infrastructure like a piped water supply, or protected spring, or a borehole. So it comes to a house, it's available. So we get this information globally by asking folks through household surveys if their water hasn't been available, say, one day out of the last 2 weeks, and that it is no contamination, which is the grand difference. I think this is the most exciting thing. Everyone was like, improved doesn't equal safe. I'm not sure if you're familiar with that argument, but we've all been to countries around the world, we turn the tap on and we don't drink the water. We previously judged that as improved because it comes out of a tap. Now we do a microbial test. We're doing Equali testing. It's going to be kind of scaled up throughout the world. And you're going to see what happens to the numbers. Similarly, on safely managed sanitation. Can everyone hear me without a mic? I hate being behind a microphone. Anyway, the safely managed sanitation. So we're looking through to sewerage, but not just sewerage. We're looking at this safe management of sanitation throughout the chain. So if you're looking at an on-site solution like a pit latrine, you're talking about emptying. First, containment, so it's not getting into your groundwater. Second, emptying if needed, because you can safely abandon. So you can actually, if you're in a very rural area that's not, low population density, you can probably just safely close it, cover it and build another one. But in an urban area, you can't do that. So how do you get this off-site through to treatment? And you could do that through mechanical emptying and vacuum trucks and so on. So that's the big difference. Now, what happens to the numbers? So we'll take a fictional country, not in any way related to Rifat's country that he mentioned, anyway, that had 98% water coverage. So through this improved. I hope you're following me here. So this is looking pretty good, and they're very rightly proud of this achievement. Now let's start applying some of these metrics. So basic. So we're going to take that metric of it being available within 30 minutes. Numbers come down a little bit. On premises. So the numbers come down again, right? Because this is talking about being on your household. A lot of the boreholes they have are, on premises, so it doesn't come down so much. Available when needed. Let's consider all the piped water supplies in Bangladesh as being intermittent, so take those away. Boreholes are fine. And Equali. Wow, now things really come down, don't they? And what has been really interesting in Bangladesh is this is one of the first places that they've done, was it a multiple indicator cluster survey? So this is where one of the first countries they actually did the Equali testing. And they found out the water in some of these pipe supplies was actually worse, right, than some of the private supplies. And we find it really interesting that piped water supply quality might drive down this overall notion of safely managed water. So anyway, you see a number going from 98% to 50% there. What is that? So then this is what I want to talk about a little bit, and Rifat and I will cover it, but it's, on one hand, how are countries going to react to this changing goalposts in terms of their own situation? And then on a more practical level, responding to the different drivers, which we all feel are very important. How many of you have seen or are familiar with what we call an excreta flow diagram? There's a lot of people familiar with those. Maybe I'll just sort of walk you through it really quickly because it gets a little bit sort of complex, but we try to make it simple. But on the left-hand side here, you see this particular country. Again, a real country. 74% of the country currently has an improved sanitation. So we move over to the right and we think, okay, well, a good chunk of that improved is going off-site, right? So and then you start looking at where there's deficiencies in containment, whether the sewerage pipes are leaking. And whether it's going to a treatment plant that actually treats things appropriately, and then you're looking at another big drop-off on safely managed. Similarly, on site, things start dropping off, and you've gone from 74% to 30 or 34%. So the world really changes then, this is we've all patted ourselves on the back to say we've done so well on water, and now we're back in. Could we be back in crisis mode? Again, for sanitation, numbers, being cut in half, but generally similar patterns throughout the world. That's just on status and not on projections into the future. Am I still speaking? Or do you want to? Okay. I'm forgetting anyway. So basically, when we've sort of talked about a lot of this with countries, I think a lot of the countries really recognize, and the arguments and discussion that Rifat talked about the SDGs, everyone agrees with leave no one behind. we care about people that don't have water. Everyone agrees with universal access. There's a huge aspiration there, but when you start actually saying, well, you know, this is kind of the way the framework is going to be set up for measuring this, then it's like, oh, did we really sign up for that? And it's interesting because some of the discussions have been at this high level, and maybe they've been missions in New York where they talk about this, but some of it has been the level of the statisticians. Rifat has gone to all these global world statistical, what's it called, the IAGs, sorry, what is that? What is it?
Interagency Expert Group.
Right, sorry, the acronyms kill me. You know, and so there's different stakeholder groups involved in these things, and there's a lot of disconnection, and there's a lot of disconnection between what one would sort of do as a sort of national statistical agency and versus the sector folks that are actually doing monitoring to improve things. So those people that might be, okay, we've got E. coli in your water supply, we need to, you know, put a boil water advisory in place, are a lot different than those regulators are a lot different than the people saying, oh, what's your status in your country? But at the end of the day, there's not a lot of knowledge about these indicators and how it will drive change. I think you're...
Yeah, thanks. So, what did we learn from the MDGs? What did you learn from the MDGs? I think somebody, anybody.
We have prizes.
Yes, please.
The economics is the first thing that people think of, and environmental is the last thing they think of, even though there's reasons for it. So.
Right. What else? Anybody else? Yes, sir.
Not doing as well as we thought we were.
Not doing as well as we would.
Tendency for governments to work on policy rather than implementation of policy.
Now we are talking. Anything else?
That the focus is on developing countries and maybe made us forget
Excellent.
our backyard.
Mm-hmm. Yes.
Neglected population growth makes all of the goals more difficult.
Yep. I think you're all right. Yeah, please.
It looks like there's a deeper understanding of the actual issues. So instead of just saying we want to make it better, we want to say what makes it good enough.
Yep. Anybody else?
Identification of the goals actually allowed focus, and that's got both positive and negative side effects, but they had an unexpected potency over the last 15 years.
Right, yes. You had your hand up? Somebody? Yep.
The Pacific did worse than the rest of the world.
Absolutely, we'll come to that, yeah. Very, very close to almost at the most disadvantaged ones. Yes, anybody else? Well, I mean, here are some of the lessons. I mean, all of you are absolutely correct, and these are some of the salient lessons, and some of that you actually mentioned. So there has been huge gains. I mean, Bruce showed that. Of course, we didn't actually show the 1990 baseline, but if you actually take the number in terms of billions, 2.6 billion people gained access in 25 years. I mean, the period of the MDGs, even the MDG was signed in 2000, the baseline was set for 1990. So it was actually 25 years. So 2.6 billion people gained from not improved sources of water to improved sources of water. And 2.1 billion people gained access to improved sanitation for the same period. Now, that's only addressing the half of the population. And improved, as you know, that you probably had it 100 years ago. So I gave a talk at the European Economic Commission, and people are just having a blank stare at my face. You're talking about improved pit latrine? This is something we did it in 1800s. So that's the thing. Now, we are no longer doing pit latrines. We are not doing improved sources. We are not talking about these basic facilities. We're talking about safely managed. And that challenges everybody. So, but MDGs has also been, somebody said, the disadvantaged, the inequalities. There has not been a lot of attention to that. And there has not been any attention to the sustainability. We may develop it, at whether the developments actually sustain, whether the things that were built actually survived and people still use 5 years down the road and so forth and so on. But SDGs, the first word is sustainability, as you saw. Focus on developing countries, somebody said that, and there is a lot of inequalities in the developed world as well, which MDGs did not talk about that because there was a lot of focus. Monitoring for accountability. One of the things, I'm a monitor, so I see that what the monitoring has done. So the monitoring actually gave rise to a lot of accountability, but also it has been a great advocacy tool to instigate change. So all these changes, I mean, it's difficult to attribute that if the MDGs did not take place, whether all these developments would have taken place. No one actually has done a systematic study about that. But everywhere you go, everybody talked about the MDGs. And now we are even not fully started, and everybody's talking about the SDGs. And the urgent thing now is, Bruce was alluding to, is we now have an absolute moral obligation to help the countries, because this is a tremendous challenge. This is almost an impossible task we haven't had. But we cannot say it's impossible. We all signed up to it. So we have to actually make it happen. And so us, the development partners, and you guys too, when you look at to your neighbors, you are development partners. So it's now our duty that how we can make it happen for those who will find it extra difficult. Now let's look at the countries which are close to you, close to your hearts. So this is the Pacific Island countries, and I haven't selected all of them, but huge disparities. So by the way, overall, the Pacific MDG figure is less than 50% for water, and it's only 20% for sanitation. It's a very just over 20% on sanitation. That's the overall thing. So it's literally one of the lowest in terms of coverage throughout the world in terms of region. And then even within that, you see that there is huge disparity. So you have 60% to only 4% piped water coverage. This is 2015 numbers. There is nearly 100% coverage rural improved water as opposed to just 51% coverage. National piped water coverage anywhere between 98% and just over 20%. So there's huge disparities. And similar things are in sanitation. So there is disparities urban-rural in a given country, and there is huge disparities between countries of the same region. And then, of course, as you know, that the overall picture is very grim because there is the huge population share of Papua New Guinea. That actually brings the whole thing down. So it's not, overall, it's not probably as bad, but the huge disparities are a reality. Now, SDG targets, we talked about the very beginning, and these are the red highlights I had in that slide. Now, this is the group that Bruce was talking about, the Interagency Expert Group on SDG Indicators, which is the group that is tasked by the General Assembly to develop the indicators and also to give us guidance on how to monitor the SDG targets. So this is not a group just for water. This is for the whole of SDGs. And they're saying that this is the general guidance as to how we should set up the disaggregation. In the MDGs, the water and sanitation were disaggregated only for urban and rural. Now we are talking about income disparities, sex disaggregation, age, race, ethnicity, migratory status, disability, other geographic location, and any other characteristics of relevance. So, huge task at hand, as you can imagine. So we, as the Joint Monitoring Program, this is a program that we have been running with UNICEF for 25 years. We just had our silver jubilee last year. So we didn't cut the cake. We just produced our report and embossed it with a silver 25-year embossing. We said we thought that this is the time that we actually look at systematically at how we're going to be doing all these inequalities monitoring. So we had a task force that met earlier this year, and we started to prioritize because a lot of people think that the JMP is basically an army of people sitting in Geneva and New York, but you're actually looking at 1/4 of the JMP. So we have to prioritize. We have to see that how we can do this mammoth task. And we reiterated our commitment for income inequalities. We said we have to look at affordability, so just income is not enough. It is actually a term literally enshrined in the water target. We said we will try to look at sex and all this race, ethnicity, and other things. But for us, it's also very, very important to look at the disability, especially their access in extra household settings, like in healthcare facilities, schools, and so forth, and other subnational, like the NTDs, nutrition, and informal urban, like especially the slum areas, and of course, the extra household settings. So for WHO, it is the healthcare facility, the top of the agenda, and for UNICEF, it is, as you can imagine, the schools. So this is just a teaser, just to give you an idea that how we are actually approaching the subnational monitoring. So Bruce was talking about this use of the household surveys, but this household surveys have not been utilized very, very to its fullest potential. So household surveys are a very important tool. In fact, it's actually quite a unique tool because you ask the households, you ask directly the beneficiaries what they have and what they don't. So if you are talking about human rights thing, it is the closest you can go to know whether people's rights are materialized, the rights are met or not. So what we did is that in the MDGs, we only looked at the sources and we looked at the urban-rural, but the information in many household surveys go far beyond the urban-rural. It goes into subnational, it goes into cluster. So it's basically a set of 20 households that make a cluster. And so what we did is that in the subnational one, so this is Côte d'Ivoire, and we put in the water and sanitation variables there. So in fact, the number of the neglected tropical diseases mapped against the WASH coverage tells the obvious, that lower the coverage, the higher the NTDs are. And in fact, on the right-hand side, you can see that it is a hugely acute issue in the Pacific Island countries. In Fiji, almost the entire population needs NTD interventions. But currently, the interventions are very medical interventions. It's just drugs. This is the typical way of addressing an issue, although many of these NTDs are WASH-related. So if you address the WASH issue, you probably don't need to address it in a clinical manner. So this exercise is to tell the WASH people that look at beyond the WASH sector, as well as the NTD people, the neglected tropical diseases people, that look beyond just giving pills and so forth, that we need to improve the WASH, and therefore people will have, and this also gives you a sustainable development for the people. Bruce, you want to talk?
No, sorry, just getting back to the NTD thing, it's quite interesting. We've been working apart from our colleagues for quite some time. And, you know, there's a certain logic to mass drug administration. It's quite cheap and, you know, reasonably effective. But they have been worried and have come to us because of the sustainability issue. So the idea that they give drugs, but say intestinal worms, you know, they come back. And so they're saying we need to actually implement and do WASH interventions at the same time. So how can we reach out to you as a WASH community, and how can we kind of target interventions together? And similarly with trachoma, the face washing kind of component of that, the hygiene component is actually very much under kind of utilized. And so a lot more impetus there. So there are lots of really interesting opportunities on health. There's one, I mean, we could talk about a lot of things. One thing I did want to bring up, sort of, you know, coming from a WHO perspective, is this issue of health facilities. And, you know, so we talked about the MDG period, and that was households, right? All the information that we got was from nationally representative household surveys. So we didn't hear about schools, right? We didn't hear about health facilities, and those sort of snuck under the radar screen. And it's a pretty worrying thing when you start compiling this data. And what we did, I think about 2 years ago, is that we said, look, we're going to start systematically trolling through as much data as we can on health facilities and see what we come up with. And we have a report on this, is all available. But when the info started coming in, we got information from 56 countries, and I think something like 60,000 facilities. Some regions weren't as represented as others, and the information is not really complete. But this idea that 38%, so 40%, don't have access to an improved water source near the facility. Most of the metrics, like from these facility surveys, were within half a kilometer. So imagine trying to give care when you have to walk more than a kilometer for water. This is not, and that's not talking about water on source, or sorry, on site, that looking at the quality and the service. This is just like water anywhere near it, and it's mind-boggling stuff. And so we're really absolutely concerned. Our Director General is sort of said, look, this is something that we just have to tackle now. So actually today at the conference we have a workshop on this particular issue, trying to galvanize partners to do things. And kind of if we have this theme of monitoring, so we'll just sort of go with that for the time being. But on monitoring, they have these management information systems, and you may have heard about them for schools, education monitoring information systems. We're trying to figure out how they are used for health. And this is a colleague in UNICEF that he got sort of trolled through all the reports on these management information systems for health. And you know, water and sanitation is sort of included in the sense that it's kind of like, well, you know, is there presence of water? Is there presence of sanitation? But the idea that you can make operational decisions kind of once every few months on this, you know, is not necessarily there, right? You don't know if it's clean, and so on. So you'll be happy to know we had to. This is the last slide, so then we can start talking. So you made it through. Congratulations for making it through at lunchtime. I have this time change thing going, so you know I got to watch myself kind of going down in terms of energy levels. Which I feel bad. This is my first time to Australia, so I want to, you know, it's a really nice place to be, and I felt a lot of sympathy toward all of you that fly out of Australia and what you go through on a regular basis. So there's about hour 15 on the plane. Anyway, so look, I mean, the SDGs is sort of about cost to some extent. I think a lot of people. I mean, there's a comment in the back of the room about from you about economic issues, and you know, it is sort of economic issues. I mean, this is a number. I'd never really understand that when you start getting into billions and billions of dollars. I'm not an economist, but it's about 3 times as much as currently spent. But I think that, you know, and I talked to some colleagues on you know, within the World Bank on this figure, and they were like very cautious with me on the figure, and they're just saying, look, it's about the institutions. We heard some comments about that, and the leadership, and if you don't have those institutions, then you know that the money doesn't sort of mean anything. So we wanted to just kind of conclude there and maybe have a little bit of a discussion, but thank you for listening and inviting us here.